A Timaru cannabis grower who threatened to go on a hunger strike if he was jailed has been sentenced to 6 months home detention. Peter Davey claims he grew and used cannabis to only ease the pain caused from a tumour he had, and he says he needed to stay at home to care for his partner, who has MS. The case has attracted the attention of those wanting a law change to allow the use of cannabis for medicinal purposes. The Green Party supports the idea. Its co-leader, Metiria Turei, joins me now. Good morning.
Good morning.
Now, you support the idea of medicinal cannabis. So do you consider this ruling perhaps a small step forward? He has avoided jail.
The judge has treated Peter Davey with some compassion, and his family and his partner as well, with some compassion by making sure he doesn't go to jail. But the question is, should he even have been subjected to the court process? Should he continue to be threatened with jail time? The judge has said to him if he's caught again, he will go to jail. Now, I don't think that's appropriate when you have ill New Zealanders who need to be treated with compassion and whose doctors are often aware that their patients are using cannabis for medicinal purposes but can't support them because it remains illegal.
It's a very difficult area, though, isn't it? In the case of Peter, I understand he had some 45 plants in the backyard. How can you police possession for medicinal use and the potential for supply? It's a lawless area, really, isn't it?
Well, that's the problem with the law being so irrational. As it is at the moment. It means that people who have issues with cannabis, whether it's medicinal issues or abuse issues, actually can't find a legal means by which to sort these problems out because they're so frightened of the law. And the law it doesn't work at all to manage the complexity of this. I think at heart, though, if we are talking about medicinal cannabis, it's the medical profession who need to be making these decisions for their patients, not the ministers, not politicians. The legislation that the Greens proposed would make the decision around using medicinal cannabis one that's made by a doctor and their patient, and that patient would then be registered with the police and with the health professionals so that everybody knew, or the authorities would know what the situation was. And that is one way of managing quite a complex issue that's about taking care of New Zealanders who are very ill.
Yeah, our drug laws do tend to need an overhaul by the looks of things after some 35, 36 years.
Yes, they do. And the Law Commission has said that there's a moral imperative that the government undertake clinical trials of medicinal cannabis. They've also said that the police should no longer prosecute those who are caught with growing cannabis or with cannabis who are using it for medicinal purposes. I mean, I think the New Zealand Medical Association supports trials into medicinal cannabis as well. I think the authorities who know about these issues want there to be a change, but politicians are resisting for no good reason, and ill New Zealanders are being hurt as a result.
Well, that said, Simon Power, the Justice Minister, says medicinal marijuana are absolutely not going to happen on his watch. He's pretty adamant about that. So what does that mean for the future of medicinal marijuana?
It means that for those ill New Zealanders who are at risk of jail time because they find this an effective medicine, are left without support and on their own. It means that their doctors who support them or are trying to find ways of supporting them are left in a legal hole as well. It's irresponsible of Simon Power not to treat medicinal cannabis seriously and to provide for the clinical trials that the Law Commission is proposing.
All right, Metiria Turei, thank you very much indeed for your time this morning.